Karen is the founder and president of the COVID-19 Longhauler Advocacy Project. She has a Bachelor's of Science in Exercise Science and Health Promotion and was a firefighter and paramedic when infected with COVID-19 in March of 2020. She sits on the advisory board of the Long COVID Research Fund, serves on the Ancillary Studies Oversight Committee for the NIH's Recover Initiative, a nationwide study into long COVID, and is a single mom trying to navigate being newly disabled. Thank you for being here with us today to share your story, Karen.
Thank you so much for having me. Hello, everybody. My name is Karen Bischoff, and I am the founder of the COVID-19 Longhauler Advocacy Project, a nonprofit whose mission is to advance the understanding of long COVID and expedite solutions and assistance for long haulers through advocacy, education, research, and support. I am what we in the long COVID community call a first waiver, someone who got COVID at the very beginning of the pandemic. I have been sick since March 2020 after becoming infected while working as a firefighter paramedic here in South Florida. Unfortunately, millions in the US, just like me, have been sick for over 2 years and remain without resources. For many long haulers, this reality, the lack of resources available to them and their families, is a shocking wake-up call for the same system so many in the disability and chronic illness communities have been aware of and fighting to improve and trying to raise awareness about for decades. It is now in this time, as the rest of the country begins to move back into their normal, forgetting all about the millions who died and the approximately 40 million now suffering long COVID, that we need to make a commitment to one another to not give up and not let history repeat itself, leaving all of us forgotten and in the past. In a tumultuous time of change and upheaval, it is our time to rise and ensure equitable access to medical care and social supports, a basic right for everyone. If we cannot accomplish this after the impacts of the COVID-19 pandemic, we likely never will. This is a call to action for all hands on deck to ensure that this does not happen again. For the last 26 months, I have been unable to work. I have had to manage not only my new physical health issues, but all of the socioeconomic aspects that come along with it, not to mention everything that comes along with caring for a child as a single parent. The all-out effort of finding and identifying competent healthcare providers have been like a full-time job in addition to trying to navigate the numerous benefits programs I so desperately need. I have gone through unemployment, workers' compensation, Medicaid, food assistance, temporary cash assistance for a whopping $158 a month for a family of 2 to live off of. I applied for Social Security disability only to get denied twice, and I am now awaiting a hearing. Long COVID is really this unforgiving collection of post-viral illnesses, all of which we knew about before, but for some reason ignored during the pandemic, with one of the worst viruses to date. Over 200 symptoms have been documented in long COVID, many of which are part of the 3 most prevalent conditions in long COVID: dysautonomia, ME/CFS, and mast cell activation syndrome. Many are also developing fibromyalgia and other chronic pain conditions, autoimmune diseases, chronic migraines and headaches, as well as motility and inflammatory disorders of the GI tract. All of the conditions mentioned I have developed. At 27 months post-infection, I still suffer with nearly 90 symptoms. I've seen about 40 doctors, and at this point, I am at a standstill with treatment because there is nothing left to try at this time. Having one of these conditions alone is bad enough, but to have a collection of multiple disabling conditions makes ADLs nearly impossible. As the world seemingly embraces its endemic stage, as we continue to tally deaths and disability in the thousands daily, ignoring the impacts to the economy and near certain collapse of our medical systems, we will fade into the background. We must collectively recall history and rapidly take action to prevent the millions of newly disabled long haulers from being forgotten and losing the monumental opportunity long COVID has presented for all of the chronic illness and disability communities. We must welcome allyship and work to consistently collaborate with one another, government officials, and health agencies to move the needle forward. I truly believe one of the most beneficial things for the long COVID community was the early education provided to long haulers by other chronic illness communities and disability organizations. I am a firm believer in cross-community education and believe it is one of the best ways we can build a consistent and solid foundation for our collective needs and desired outcomes. We must build a system that does not force us into poverty or progressively worsening health due to its inaccessibility and complexity. We can and will prevail if we choose to do so. If not, there will be no return to normal for millions of Americans, and that should never be ignored, forgotten, nor accepted. Thank you.
Thank you so much, Karen. I'm sorry that you've had to endure all of that. Your experiences and those of countless others worldwide really drive home the importance of fighting for transformative changes that we need to repair the damage and make sure that this never happens again.